Cancer researchers recently did a study on 2,100 patients over a 17-year period in which they looked at dietary supplements and diet and the effect it had on cancer healing. The results were incredibly interesting. Today, I'm going to break down the study and share with you what is the takeaways from the study and how you can start getting better from your cancer.
You're watching the Dr. Jake podcast.
I'm Dr. Jake. I'm a naturopathic medical doctor and integrative physician in Salt Lake City, Utah. On this channel, I share with you how you can heal your body and get your energy back down to the root cause without any harmful drugs or surgery. All right, let's get started. This was a study that was a prospective study, meaning that it was done over a period of time. And what they did is track 2,100 patients over a 17-year period. And this was done on older female patients, 50 and older. So a lot of the stuff we're going to be talking about, you can't necessarily extrapolate that to younger patients or male patients, but it does still give us a great understanding of dietary supplements and diet and its effect on cancer outcomes. So some of the questions that many patients have and doctors have: do dietary supplements affect cancer treatment or care? Does dietary supplements increase growth of cancer? Does dietary supplements increase longevity? And a big one is, does diet have any effect on cancer? Does it increase quality of life or longevity at all? This study looks at all these different issues in here. So like we said, it looked at 2,100 patients over a 17-year period, and they had the patients fill out a specific questionnaire over that period. So some things that I really like about this study is it has a lot of power because it was done on 2,100 patients and it was done over such a long period of time. Most studies, it was done it's done with 3 months or over a 12-month period of time. That could give us acute reactions to diet or supplements, but it doesn't give us really the long-term benefit, which is what we really want to look at when we are taking dietary supplements or following a diet. Some things that I don't like specifically about this study is that it is only done on female patients, it's only done on older patients, and it's not a randomized placebo-controlled study. But that is extremely difficult to do when you're just tracking patients. So I actually like portions of this piece. It was just tracking patients, letting them live their lives, having them fill out certain questionnaires so we could get great information about what is really going on in these patients' life and see if it really affected their life or not. So a big question that many patients have, and especially doctors, and many of my patients talk to me about is, okay, I'm taking this specific nutrient. Is this going to increase my cancer growth, or is this going to affect my treatment? So big ones that they've been talking about is folic acid and vitamin E. I hear this a lot among my patients. A lot of doctors are telling my patients, hey, we probably shouldn't do vitamin E because it's an antioxidant. We shouldn't do folic acid because we're seeing in some research that it might increase cancer growth and worsen outcomes. In this study, it didn't see that at all. So in this study, they tracked how much vitamin E the patients were taking. And they saw that patients that were taking more than half recommended daily value of vitamin E, they saw that their cancer was actually doing better. It wasn't doing worse. So when they were taking vitamin E, they were able to live longer and have better cancer outcomes compared to those that weren't taking vitamin E. In folic acid patients, they found similar responses. They found that patients that were taking folic acid actually did better, and they were taking more than the recommended daily amount of folic acid compared to those that weren't taking folic acid at all. What they did find, though, in this one, and this wasn't with vitamin E, is they saw that patients that were taking folic acid and had poor diet saw that their cancer actually got worse. So this could have a lot of confounding variables to it, though. I mean, you could be looking at okay, were they just really poor diet and they're losing a lot of weight? That could have been there. They could have had other medical conditions going on. Is it related to their cancer treatment or just related to the cancer getting worse? So there were confounding variables there. But this also puts in the fact that we need to be following a good diet, which is a thing that this study did look at too, that I really love, is it didn't just look at supplements like vitamin E, folic acid, even though this study looked at a ton of different vitamins. We're not going to dive into that in detail here, but I wanted to talk about these specific vitamin E and folic acid because I know I have a lot of patients of mine that ask me about this because they have their doctor saying, hey, you probably shouldn't be taking vitamin E and folic acid because we see that this can increase cancer growth. We're not seeing that. I don't see this in the other studies I see. And then we actually have a study that followed people over 17 years of taking these dietary supplements on 2,100 patients. And we actually saw that taking these supplements improved cancer outcomes. So it was really good to see that. And I've been telling my patients this for years, but it was good to see this recent study that came out showing us this information. So let's talk about diet and see, does it have any effect on cancer? This might sound crazy to some of my audience, be like, what, diet? Is that even a question? But probably many of you that may be listening here have heard from your doctors or your oncologists saying, hey, diet doesn't have any effect. And really what you really need to do is just make sure you keep the weight on. That's all you need to do. You could eat as much Jello or cake or whatever you want. That's not going to have any negative effect on your cancer. And what we're seeing in this study is that's absolutely false. So what they saw here is they had dietary questionnaires and they made up what was like a good diet and what wasn't a good diet. I could debate some of the things they consider a good diet or a bad diet, but it still has good information in here. So what they saw that a poor diet score were people that weren't eating enough carbohydrates, meaning and not enough protein. So what was happening is they were losing a lot of muscle mass. So a big thing we do want to do with cancer is we do want to maintain the muscle mass up, but that's what they saw. They saw patients that were not eating enough protein, not enough carbohydrates, and they weren't eating enough fruits and vegetables, and they were drinking a ton of alcohol. So this population group that were doing that had poor outcomes with their cancer. And patients that had good dietary scores, patients that were keeping their muscle mass up, were getting enough protein into their diet, getting enough fruits and vegetables, they were having good cancer outcomes. And they were having better outcomes combined with the vitamin E and folic acid supplementation. So what we can see here on this study is what you eat does affect your cancer outcome. What I do for my patients, some foundational supplements and dietary advice that I do for my patients is that I recommend that they always have good nutrient status. So I like them to be taking a multivitamin if they're not getting a good nutrients into their body. I also, a big one is I like them to be taking turmeric. I like a liposomal turmeric that helps it get absorbed more readily. Now, turmeric, you don't necessarily want to take with many chemotherapeutic agents. So you need to go to a doctor that knows what they're talking about to tailor that. Some you can do it for some chemotherapeutic agents and others you don't. So it needs to be specific there. But if you're not doing chemotherapy, this is one of my favorite herbs because it works on so many pathways and helps with so many different cancers. I also really love boswellia, which is called frankincense. I love quercetin. I see this work on so many different pathways to decrease growth, directly attack the cancer cells, etc. And it works for so many different cancers. So I really love to recommend quercetin. A big thing too is I always am giving my patients vitamin D. I never seen a cancer patient, or really any cancer for that matter, that's getting enough vitamin D in their life. I mean, I've seen a few, and these are people that are sun worshipers and going out in the sun all the time, and they're getting enough. But with the lifestyles that we have now, we're just not getting enough vitamin D in. So usually, like I said earlier, we want to keep your blood levels at 50 to 70, maybe up to 80 or 90, depending on the cancer that we're treating, to keep your vitamin D levels up. So that's at least 5,000 or 10,000, or it could go up from there. So, but you don't want to just take vitamin D willy-nilly. It can be toxic. And you might not be getting enough, even though you think you're like, I'm taking a ton, I'm taking 10,000 IU. So you want to make sure you get your blood drawn to get that checked. I also really love mushrooms. There's so many different mushrooms out there that are really awesome for attacking cancer. And what the big effect they have is they're going to boost your immune system to go after the cancer cells. So some of my favorite ones that I use are chaga mushroom, reishi mushroom, and turkey tail mushroom. These are my three top mushrooms, and I change it based on each patient demographic. But majority of the time, the big ones I'm prescribing are reishi almost all the time, chaga for specific cancers, and turkey tail for specific cancers like breast cancer. So these are some of my supplements that I like to prescribe for my patients. Now, dietary approach to my patients all depends on the person. So if a patient is in stage 4 cancer, I like to recommend a plant-based ketogenic diet, making sure that they're getting enough protein in their diet, monitoring them, making sure that they're keeping their muscle mass up, that they're not losing too much weight. And I make modifications as needed if the patient isn't following it appropriately. If a patient follows the plant-based ketogenic diet appropriately, they are actually going to maintain their weight and do much better with cachexia, which is when your body starts wasting away with cancer. Now, if someone isn't stage 4, and I don't have to be really aggressive, usually the dietary approach I prescribe is a vegan diet. So that's low in animal products like meats, dairy, eggs, milk, those type of things. And then keeping their refined sugar down. So refined cane sugar, high fructose corn syrup, agave syrup, these type of things. So that's a great diet that I do. But again, people cannot get enough protein in when they're following this diet, but so they have to make sure they do. They need to make sure they get enough nuts and seeds and beans and these type of things to make sure that their protein status is up. So those are the diets I usually recommend for patients that are dealing with cancer. So like I said earlier, that I do recommend a multivitamin. I don't specifically supplement them by themselves, typically when someone has cancer, except if I see a nutrient deficiency, or let's say someone has an MTHFR gene mutation. I'm making sure that they're getting methylated folate. This is very common, by the way. 50% of people are heterozygous for MTHFR gene mutation. So you want to make sure you get a methylated folate. I always prescribe that. Every multivitamin that I prescribe to my patients, I'm like, got to make sure that it's methylated folate and methylated cobalamins, because there's so many genetic variances there and people just don't methylate their B vitamins very well. So you want to make sure it's methylated. Usually I don't prescribe these supplements by themselves, even though sometimes I do. Vitamin E is a common one that I do prescribe when I'm prescribing like a supplement, green tea, which has EGCG in it. So when I do high doses of that, the combination of EGCG and vitamin E work very well together. I do prescribe those two together. There's a product called Ultra Preventive, which has really high nutrient status in there. You're taking about 4 to 8 caps per day of that has methylated folate in there, methylcobalamin. There's also a multivitamin by Integrative Therapeutics. Their multivitamin is really good. There's also a multivitamin by Orthomolecular, which is really great also. So there's a lot of great products out there, but those are some of the 3 professional brands that I like that I know have good nutrient status in there and are going to give the nutrients in the appropriate way. If you want to learn more about dietary supplements and diet to treat your cancer or other health conditions, click my video to the right. I'm Dr. Jake, and I'll see you there.